in 1976, I was hired by what was then the South Central Community Mental Health Center. And originally I was working in the evaluation research department. And I had been hired because they were looking for somebody with skills to interview elderly alcoholics that were participating in a research project there. But at the time, we knew there were federal funds available to start specialized mental health services for older adults. And so that first year, I also wrote a grant for the service, and it was funded. It was really the tail end of the Great Society era, when community mental health centers and developmental disability centers and the War on Poverty programs and so many different kinds of programs were initiated during those years. And those were the fat years for community mental health. Community mental health, similar to what was happening in the field of developmental disabilities, was undergoing a real radical transformation towards deinstitutionalization. And community mental health center system, like the Area Agency on Aging system, was set up to provide mental health services in every region of the country through federal grants. And I think the center in Bloomington was established probably 1969 or 70, something like that. It was a fairly small operation at that point. I think maybe there were 30 or 40 staff at the Community Mental Health Center. When I left, I think there were 70 or 80. But we didn't have a whole lot of data to know what kinds of services were needed for older adults. I think we had done some community discussions, some focus group kinds of projects to begin to look into it. We knew that there was a necessity to really reach out to an older adult population that really wouldn't be familiar with the notion of mental health services. And I've told this story many times that after I was hired, I went to a meeting of a bunch of old women who were putting the Senior Expo together. Might have been the very first one, and they met at the College Mall and in a separate meeting room. And so I found myself in a room with about 10 what I call wrinkled radicals. They were the Senior Citizens Action Congress, kind of Bloomington's version of the Gray Panthers. And so we went around the room and introduced ourselves to one another, and it got to me, and I said, I'm Phil Stafford, and we're just beginning to develop some specialized mental health services for the elderly in this community. And I got no reaction from the group. And I said, and I added, and I have a pickup truck and I can haul chairs for Senior Expo, and I got practically a standing ovation at that. So anyway, I knew that it would require a service that paid special attention to presenting the mental health center in a good light so that people could begin to trust what it was, making available. I remember when we built a new building for the mental health center, which would have been probably 5-6 years later, I was giving tours to older people through the building, and I remember one old person saying, "Where do the patients live?" And so the idea of a mental health center connoted a hospital, for that generation of people. And it was something that they really didn't talk about too much, that you really didn't share information. If you had somebody who was mentally ill in your family, it was, something you kept in the closet. And up to that point, people with serious mental illness, there were very few resources in the community, and more often than not, somebody might just be carted off down to Madison State Hospital if they needed, significant care. Our service was very much oriented towards community-based services, and I think we had a staff of 5 or 6 people. 3 of them were, at least 3 or 4 were outreach workers, paraprofessional outreach workers. And so we were quite capable of doing home visits. If the center would get a call about an older person who was suffering, we would send an outreach worker, and sometimes that would result in a client relationship, in which case they would always be seen in their own home and for counseling. And the outreach worker, if a person needed a psychiatrist as well, the outreach worker would visit them in their home and then bring them in their car to the mental health center, help shepherd them through that process. And I found that I found myself doing a lot of counseling with older people, and not being a trained clinician, I was not permitted to do emergency services after hours, although I used to do them during the week when there was a psychiatrist on staff. But I did a lot of individual counseling with older people, which I just loved, because so much of it was just reminiscence therapy. And often the goal was to try to normalize some of the difficulties that they were having, if they were having depression or anxiety associated with their aging. And secondly, help them look back in their own lives and reflect on the strengths that they had used to overcome challenges earlier in life. And often they would be able to bring those strengths into their current situation and rethink, what was going on, and sometimes confront situations that they needed to confront, critical conversations with family members and things like that. And just a listening, trusting ear was also helpful to people in those circumstances, because there was a lot of anxiety associated with illness or specific mental problems that they were experiencing. We started a mental health, or an adult daycare center while I was there, and there was a time where dementia could be given a diagnosis in the manual, which is called the Diagnostic and Statistical Manual, and we could provide mental health services through the adult day center to somebody for an extended period of time, and this might be 5 days a week, for 6 hours, and we would get reimbursed for doing that because they had a mental illness diagnosis. In the mid-'70s, Ronald Reagan became president and introduced what he called the new federalism, and the idea was to begin to diminish the federal responsibility for these kinds of services, and it had a direct effect on the ability of the community mental health center to sustain particular kinds of services to older people. And at the same time, the Medicaid provider in Indiana changed, and in order to save costs, the rules and regulations around what Medicaid would reimburse for mental health services also began changing. And for one thing, there began to be an emphasis on what they called brief treatment. The idea would be that somebody would come into the mental health center and be seen for 30 days, and you would have to document their progress. And if you couldn't document the progress, then their treatment would be cut off. That became pretty difficult to do, given the standards for documentation. That became difficult to do for people with dementia, who were going the other direction. And so essentially it became impossible to serve people with dementia in that particular setting. And so we began losing staff at that point for specialized older adult programs. But we were able to sustain it from, about 1978 until about 1989. I left the mental health center in 1989. In many ways, certainly the visibility for older adult mental health issues and needs in the community has diminished, and I think to some degree the services have as well. There are a lot of therapists around town who got their start at the community mental health center, many of the best and most experienced therapists in town. And I've noticed that as they age, and many of them are contemporaries of mine, that they've developed new interests, in this whole issue of aging and caregiving, so I think the skill level of the private therapeutic community in Bloomington is probably better than it is in the past.